welcome to AMSA Uttar. In this last video in conjunction with AMSA Health Day, the topic we'll be sharing is binge eating disorder. But before going to that, please subscribe to our channel and turn on the notifications so that you won't miss out any of our videos.
Binge eating disorder is defined as regularly eating a lot of food over a short period of time, even when you are not hungry, until you are uncomfortably full. Most of the time, people develop binge eating disorder as a way to deal with a deeper issue or another psychological condition, such as anxiety and depression. People with binge eating disorder want to eat food to ease their unpleasant emotions and make themselves feel better. However, they will be flooded with feelings of regret after binge eating, and eventually binge eating will lead to obesity. The worse you feel about yourself and your appearance, the more you use food to cope. Hence, it will become a vicious cycle. But note that there is a big difference between binge eating disorder and bulimia, where both involve binge eating, but you will try to make yourself throw up by using laxatives or exercise in the case of bulimia.
According to several statistical sources, almost 9% of the world population is affected with BED. In Malaysia, roughly 300,000 people suffer from BED, as the most affected ones were university students across Malaysia. In 2020, there was a cross-sectional studies conducted among students, and the results showed that 13.9%, which is an equivalent to 1 in 5 students, were at risk of BED due to actions of losing weight or post-traumatic stress disorder. BED can affect everyone, especially women. It is, however, the most common eating disorder among men. BED often begins in the late teens or early 20s. As compared to other eating disorders, it is found out BED affects 3 times the number of people diagnosed with anorexia and bulimia combined.
The exact causes of binge eating disorder are not well understood, but likely due to a few factors, such as gender, social and cultural factors, where most of the people nowadays thinking that one should maintain a slim body figure in order to be considered good looking, which will create pressure on people in the society. Besides, one's family history of having eating disorders will greatly increase the chances of them getting binge eating disorder. Psychological problems such as depression, stress, anxiety, and low self-esteem are often associated with eating disorders. Lastly, emotional trauma such as childhood bullying due to weight will cause one's emotional and psychological changes that lead to eating disorders.
To identify if someone is having BED, the signs and symptoms are the key points. People with BED will eat faster than normal people do. They will eat even if they're not hungry. They cannot control how much they want to eat, therefore they will never feel satisfied no matter how much they eat. In the end, they will only stop when they feel uncomfortably full. Usually these people will eat alone and secretly hide from others due to embarrassment. Most of the time, they will feel depressed, guilty, ashamed, or disgusted after binge eating instead of feeling satisfied. This will exacerbate the situation as they were initially wanting to ease their emotion through binge eating.
In order for a healthcare professional to diagnose whether or not someone is having binge eating disorder, the signs and symptoms as well as the following points are equally important. One is considered having binge eating disorder if they have binge eating episodes at least once a week that last for a minimum of 3 months. The category of binge eating disorder is classified based on the frequency of binge eating episodes, where people with 1 to 3 times binge eating in a week is considered mild, 4 to 7 times a week is moderate, 8 to 13 times a week is severe, and more than 14 times a week is extreme. Hence, these are the things that everyone can pay attention to themselves and people around them to prevent any possible cases of binge eating disorder.
BED is left untreated, several complications can develop. In most cases, BED will cause weight gain and lead to obesity due to increased calories intake. Health risks associated with obesity such as cardiovascular disease, example, heart attack and stroke, and also type 2 diabetes may also occur. People with BED may also suffer from malnutrition due to an imbalanced diet. As most cases of eating disorders are associated with psychological problems, Untreated eating disorder will exacerbate one's emotional and psychological problems, such as depression and anxiety. This will lead to sleep problems, example, insomnia, and also menstrual problems in the case of female.
Here are some treatment choices and recovery tips that can help to overcome binge eating disorder, but please do approach your doctor to seek for professional advice. The very first treatment we have is cognitive behavioral therapy, which is a form of psychological treatment conducted by a professional therapist that has been demonstrated to be the most effective treatment for a range of problems arising from binge eating disorder. Next off, we have interpersonal psychotherapy. The goal here is to identify the specific problem linked to the negative eating behavior, acknowledge it, and then make constructive changes over 12 to 16 weeks. Besides, weight loss therapy is also a treatment to help people lose weight, which may reduce binge eating behavior by improving self-esteem and body image. Medications such as lisdexamfetamine are helpful to suppress the desire to binge, and antidepressants can help with conditions such as depression and anxiety. The last treatment included here will be group and family therapy. It helps the family members to understand your eating disorder. In group therapy, you can find support and openly discuss your feelings and concerns with others who share common experiences and problems.
Here's a quick guide on how to prevent BED. You can keep a food and mood diary. Identifying personal triggers is an important step in learning how to control binge impulses. In addition, one can practice mindfulness, as it helps increase awareness of binge triggers while helping increase self-control and maintaining self-acceptance. Moreover, you can find someone to talk to. It is important to have support, whether it is through a partner, family, friends, binge eating support groups, or online. Choosing healthy foods is crucial, as a diet consisting of food high in protein and healthy fats, regular meals, and whole foods will help satisfy hunger and provide needed nutrients. In addition, start exercising can help enhance weight loss, improve body image, reduce anxiety symptoms, and boost mood. Last but not least, you must get enough sleep, because lack of sleep is associated with higher calorie intake and irregular eating patterns. It's recommended to get at least 7 to 8 hours of good sleep per night.
Here's the end of our video. Thank you so much for watching, and please subscribe, like, and share this video so that we can help to raise public awareness regarding different types of eating disorders. Don't forget to watch our other videos, and we will see you soon. Bye.